Hey, I'm Dr. Bob Payne, a veterinarian at southkendall.com. Let's talk about nasal and throat congestion in cats and how to treat it. It's very hard to give anything intranasal to a kitty. I used to give neosynephrine in a diluted form intranasally, and they can't hardly stand it. So I found if I do have a nasal or throat congestion, sometimes I'll do what we call nebulization. We'll put them in a small cage and throw small particles that are atomized into small particles. And we put saline, sometimes we put like mucomist, which is acetylcysteine. Sometimes we'll put antibiotics depending on what's causing the sinusitis or the nasal or tracheal inflammation. If it's that bad, I'd recommend a blood count by your veterinarian and possible x-rays, because it could be something that's occluding the passageway and looking like it's congestion. If it's a viral or bacterial infection, you may need antibiotics or antivirals. So it needs to be defined by your veterinarian, and the proper direction of treatment should be then given after that. But to treat it just as a treatment over the counter stuff, I'd be very hesitant to use that, because you can't give anything intranasally. If you have a nebulizer and you want to use saline, it may help. As far as viral infections, unfortunately, there's not many things that cure them. There's not many things we have that cure those. And sometimes they become chronic, intermittent problems. Sometimes you'll see them get better, and the stress will bring it out. So reduce the stress, nebulization, and call your veterinarian and see if she or he can give you a better treatment direction and give you ideas on how to treat that. Sometimes blood work is necessary, and obviously sometimes x-rays are necessary. If it's a deep-seated problem like congestion in the lungs, we see sometimes cardiac problems that can cause fluid in the lungs and look like a tracheal or sinus problem, and it's really a respiratory problem secondary to cardiac or even cancer.